journaled pretty regularly, and then when I got the diagnosis of cancer, I didn't know if I could keep up with it, and I didn't want my last writing to be the day I died or the day before. When I left off in the journal, I said I'm diagnosed with colon cancer. June 4th, 2020, went outside to pull weeds, and I went to stand up, and I couldn't stand up. Excruciating pain.
Marci Bogenrife is an amazing patient. She established with us in the summer of 2020 after presenting to our emergency room here with acute abdominal pain. Unfortunately, they recognized that this was a critical situation.
Doctor said, "What hospital do you want to go to?" I said, "For what?" He said, "You've got a 2-hour opportunity to do something about this." He said, "You need to go to OSU and the James." That's when I knew something bad had happened.
And she was transferred to the James, where she underwent emergency surgery for what was felt to be a perforated colon. She ended up meeting Dr. Lisa Cunningham during that time and was identified as having what was felt to be metastatic colon cancer.
So they asked me to come in and help with her procedure, and I did. And then I got to meet Marci the following day. I got to walk into her room and say, "Hey, you don't know who I am, but I know who you are, and this is how we're going to work together to fight this." You know, patients who have to undergo these extensive chemotherapy regimens with cancers that are as, advanced as Marci's was, it can be very hard for them to travel here to get care at the James. Whereas they can go to their local facilities, be close to home, especially when those chemotherapy regimens make them feel pretty poorly. And so it's really nice for them to have their care close to home, close to their support systems.
Patients, also in the time of their need, just having someone listen makes a big difference, and sitting and letting patients talk, oftentimes, the visits and what we need out of it from a medical standpoint are fairly quick, but what time that patients need for that visit is much longer, and sitting and listening and talking with patients is an amazing part of what we do, and being a small community allows us to spend, time that maybe we wouldn't have in other places.
I think it's really miraculous how well Marci is doing now, years out from her, emergency surgery. She's back to her community doing wonderful outreach. And I think that it's just a true testament to her grit, but also the care that we all provided her, that we got her to where she is today. Because many perforated cancers really don't do this well.
Everything was perfect at the James and Madison Health. I'm here because of it.